And we are live. Hello, Facebook and beyond. Michael Spermuli here with the next installment of COVID-19, Real People, Real Perspectives. For those of you who have not experienced this before, this is simply just a conversation with people like you. I'm wanting to bring various viewpoints and insights as to how this situation is currently affecting everyone. And today I'm very excited to be with our guest. We'll get her up on the screen here in just a moment. Patricia Causey is a licensed mental health counselor and has a thriving counseling practice in Valdosta, Georgia. And I'm going to hit this button here. And let's cross our fingers, and it looks wonderful. And there is Miss Patty. Patty, say hello to the world.
Hi, Michael. Hello, world.
Thank you so much for being here. You're going to have a good perspective on this. I think that'll help folks realize, A, they're not alone, and B, just from the mental health side of things, as far as how we can navigate through these unprecedented times. So thanks for taking some time to spend with us today. Before we dive into some questions, if you have comments, we've got the stream configured so that I'll now be able to see them on the screen. So go ahead and put those in the box there and we can address those as we go. So I guess the first question is, how has this impacted counseling?
Well, it's really different. I am on my office, Therapy Center Valdosta, is on week 3 of having transitioned over from face-to-face counseling to everything is absolutely online. So we have transitioned successfully from open doors of having people come into our offices and sit down and have any type of individual, marriage and family type counseling to now we do it all just like you and I are talking to one another, Michael.
Now, how has that been on the client side of things? Have they been receptive? Has there been some resistance?
Well, I'll tell you, it's really been interesting because I will say that our current clients have I would say maybe 10 to 15% were skeptical and a little nervous about it. But I think because we are such an electronic and such a social media type world that people have adapted really quickly. And the people who were already receiving services have continued to receive services. The issue comes into play when it's brand new clients. I think that we're not getting people seeking help right now, although we know people are struggling. I recently put up just a little meme on my on our Facebook page. Therapy Center has a meme or a Facebook page, and I asked people to respond how they were doing based on, it was a little meme that I had borrowed from someone, and it has a different color heart to say how you're doing. So I think
Sure.
Blue is happy and green is, or no, that's backwards. I think green is happy, and as you go down the spectrum of colors, you can say I'm doing okay, or I'm struggling, or I need maybe to seek some help based on the color heart. And what we found is that a majority of people, and it's only been up for 2 days now, are either saying I'm struggling, or I'm just doing okay right now. And so people, they want help, and they're acknowledging that they're feeling isolated, that they're having a lot of anxiety about the changes in the world right now, but they're hesitant for whatever reason to seek help at this point. And so there's been a slowing of people seeking counseling, but I think people have continued to get help that are already getting help.
Are you guys taking new clients on in the middle of this?
We absolutely are. We have, at my office, we have 6 clinicians. We have 5 licensed professional counselors and 1 licensed marriage and family therapist. And what we've done is we're all working remotely, but for safety purposes, we've let our secretaries have the space in the office where they can socially distance from one another,
Sure.
answer phones from referral sources, from patients who want to reach out and get help, and then they are able to remotely communicate to us that we have new patients. And really the intake process is probably the easiest part in starting counseling anyway, because that's the part where it's hard to initiate the counseling, but you're really there just answering a lot of questions.
Well, first off, you said a lot there, and this is great stuff.
Sorry.
No. That's excellent. This is exactly what I want this to be. This is just a conversation. And full disclosure, Patty and I went to graduate school many moons ago together. We were in the same graduating class. So that was back when I was doing clinical work, and
Yeah.
what was I thinking? That's another story for another time. I totally forgot where I was going to go here. So the one piece is, you'd mentioned people are struggling. I was speaking to a friend of mine. I've been talking to a lot of folks in different industries and from different viewpoints, from physicians to people on the front lines. I'm going to have an EMT on, I think, tomorrow and give his perspective. But one of the things that I think is important that you hit on, and that is, it's okay to feel out of sorts right now. No, I don't know anyone. People who say, "Oh, I'm having a great. I'm doing okay." I'm not. I mean, my whole world has been upended. Parts of it are stabilized, but this is unfamiliar. Speak a little bit about because we know in a lot of times seeking counseling services or any type of therapy, unfortunately, still has a stigma that comes along with it. If this doesn't rip the stigma off, I don't know what will.
Yeah. I definitely think that there's the stigma is still there, and with every generation that I meets, like that I meet with, like a lot of the clients that when I started, it was 20 years ago that 20 plus that we started in the industry, and so some of those children that I worked with are now adults. But with every group that I meet, I think the stigma's going away. It's getting better. And while I will say it's definitely getting better and people are more likely to seek counseling, I think that the stigma is definitely still there. And what the message that I come to share with Facebook today, as well as the one that's on my Facebook page, is to just say, this is new. We've never been through anything like this in my lifetime, and you're not alone, and we are scared to some degree, but we're also all in this together. And so a message of resiliency, and that I know we're going to be okay, and that even if you've never had a mental health issue or ever thought, well, I need to get some counseling, if you're feeling afraid, you need somebody to talk to, or maybe you're just feeling isolated, now might be the time to reach out and get some counseling.
I think a lot of times when people think about going to see a counselor or a therapist or anything, they think immediately of, I'm going to go all clinical on you, of the Axis 1 diagnoses, the hardcore schizophrenia and some of these other diseases that are typical when you think of having to see a therapist. And that's not the case. I mean, anxiety, which I think every one of us can say we have now, is something that is very beneficial to talk through and have some talk therapy address, as well as a whole bunch of other items. It's not a matter of you having to be so, I can't think of the right word, but you see where I'm going here. I mean, is that?
I do.
Yeah.
I do. Well, what I'll say about that is that that's where the stigma comes from.
Yeah.
Is that even when I have teenagers that come into my office for counseling, and some young adults, they'll say, well, my mom suggested it, or, so-and-so suggested it to me, but I don't think I'm mentally ill, or I don't think I'm so severe. And what I say is that you don't have to be severely mentally ill, although you can be and still get some benefit from counseling. Sure. But you can have adjustment issues in life. You can be going through transitions in life. Sometimes when you have loss, trauma, divorce, death of a loved one, mild areas of your life that you need coaching in, sometimes reaching out to someone who is knowledgeable in the areas that you need some guidance in versus going to even a friend or family members can be beneficial in the sense that now you have someone to talk to that is just your person. That's your person that you talk to, that you don't have to act any certain way or behave any certain way with. You just get to be yourself and do self-care at least 1 hour of the week when you go in for your counseling.
And there's something to be said too about the person being objective. You don't get that objectivity from a family member. They may be well-meaning and they may try, but it's not the same thing as a therapeutic relationship.
Right, and often it's not confidential.
Well,
to me,
yeah.
that's a very important part too, is that when you are, if you have anxiety, or like I said, going through a major life issue that you may be having, what you want is you want the stability of knowing that person's going to be there for you. You want to know that they're going to be objective and tell you the truth in interacting with you. And then that you can say anything and feel safe, that it's not going to be repeated. And that's part of the oath that we take in being counselors, is that everything we talk about is confidential, in the sense that if you share information that you don't want shared, that is of a general nature, we don't share.
Yeah. Well, that brings up an interesting point. How does the transferring from face-to-face to online, how has that impacted confidentiality concerns? I mean, I know that you'll work from the same ethical standard that you normally do, but have patients been a little reluctant to do the online route?
Right. Mine haven't. And I think the reason mine haven't is because when we started the transition over, I personally called every one of my clients. The day before they get an appointment, they get a call from me. I explain the avenue that we're using and that it is both HIPAA compliant and confidential. And that way they understand that they're not on speakerphone while I'm, buying coffee at Starbucks. They're not on FaceTime or in a mechanism that could be hacked. As clinicians, even though HIPAA has relaxed their guidelines during this very difficult time, our patients trust us to choose an avenue that will be confidential for them so that they can still feel safe.
Yeah, and that's important to stress that I don't know the system or platform that you're using, but I imagine it's in the clinical space that takes all those safeguards in mind as far as confidentiality, security, etc.
Yes.
Yeah. What would you say is besides generalized anxiety, which I think all of us are feeling right now, what do you see coming up more for clients that may be out of the ordinary?
Sure. I think that I've seen already that there's a lot of anxiety. I think that the isolation for people who already have depression can be really, really tough. And then when you add some daily life stressors to that, whether it be financial, which is big in our society right now, when you have a lot of people where their offices are actually closed at this point. I feel blessed to be able to work every day, but there are people who work in the service industries
Sure.
or other areas. Our hairdressers can't cut our hair.
Yeah, I'm about to enter a crisis. It's like this is going to get real interesting.
I'm going to cut my bangs. I can feel it. I don't want to, but I'm going to make bangs. I don't want to do that. But yeah, everything from people who work in industries that now have to stay home, meeting a financial crisis, which will be really tough, to kids that aren't at school and parents trying to juggle all of the things that come with their children being home and the stress of managing a household and trying to keep that household going, to even our first responders. I'm worried about our first responders right now because I don't know how they could even imagine doing self-care right now or having any time to do self-care. And it's with the progression of the pandemic and our numbers rising every day, I should say. They're not getting, I would imagine they're not getting counseling. They're not getting the self-help.
They're not getting sleep. They're not getting protective gear. So forget about counseling. I mean,
absolutely.
But you touched on something there that a colleague of mine that I was speaking to, and I'm going to have him on at some point in a future broadcast, Dr. Ira Wolf. He's been studying workforce trends for ages. And we had a discussion yesterday, and he said, what no one's talking about yet, and I don't want to steal his thunder, but he said, whenever the all clear is given and it's safe for people to go back to work, you don't just turn on the light at 7 a.m. and people show up and everything's back to normal. That re-entry and adjustment period, that's going to be a whole nother segment of this to navigate through, I would imagine.
Absolutely. And it's interesting because I actually have some clients that I've worked with over the years that have had anxiety and agoraphobia. And so part of what their counseling was we would start with mental health counseling, and then we would progressively get them to leave the house more and more, behavior, kind of modifying behavior, to the point where they can now come into my office. Being quarantined for weeks does not do well for people who have severe anxiety or who already have difficulty leaving their home. So normalizing, getting back to a place of socializing again is going to be hard for many people in our community and in our society.
I think patience is first and foremost, because this is going to ripple out for a while, even if miraculously we're able to cure the virus tomorrow and then have people get back into the workforce. It's going to take some time. Even if you hear someone cough, I can only imagine people be like, just because they're clearing their throat, do they have the virus? So, patience and kindness will certainly go a long way, and it's going to be needed. From the standpoint of looking at coping mechanisms and ways for people to deal with, the new normal, at least for the time being, and even if someone's not seeking therapy, what are a few ideas that you would offer to help people navigate through this, just to get through their day-to-day as we know it?
Sure. Well, I start with what I call the good stuff.
Yep.
And the good stuff is what I tell people that you want people to say about you when it's all said and done. If I died tomorrow, what would I want people to say about me? What would I want people to know about me or about how I lived my life? And if you kind of do an introspective look and say, what's my good stuff? Well, my good stuff is my family, my friends, my support system. That's what gives me the warm, fuzzy feeling of, like, I'm going to be okay. I know I'm going to be okay. So I tell people, look inwardly, look at the love and support that they have with their family and their friends, because we don't all have biological family, but some of us actually make our family out of our connections and our social network and our friends. They become our family because of that close knit. I tell them also to have a nice time with your animals. If you love cats, if you love dogs, your fur babies are also your family, and to spend time with them, and to enjoy them, and to take this time at times to close out the entire world, because we're locked down anyway. Why wouldn't we?
Sure.
And to say, if the world ends today, do I have everything I need other than the other materialistic things? And how do I grow that? How do I maintain that? How do I have just a little bit of happiness? It might be as simple as popping popcorn and having a little camp out in the bedroom, make a fake tent I have an 11-year-old, and hang out in there. It might be as simple as watching something on Netflix, or even getting outside. One of our favorite things to do is just to go. We live near a lake, and so sometimes it's nice just to go for a little walk. You can still practice social distancing. You can play kickball in your front yard. You can play basketball. And so getting back to the very basics of life that don't involve all of the social media, unplug for a little bit. You might as well, because you're not going anywhere anyway.
Well, that's true. And you touched on the material and the financial stuff. Everyone's in the same boat. Everyone is worried about where next month's rent check is coming from and where we're going to, how we're going to pay bills and what have you. That's going to get sorted out. And it's going to take some time, and it's going to be a little gnarly for a while. But if there's any consolation, realize you're not in, I know it sounds cliche, but you're not in this alone. Everybody is in the same situation. They're varying degrees, of course, but
yes. But unless you're infinitely wealthy, you have to still pay bills.
Absolutely.
And even infinitely wealthy people have to, but they have more money, and that's just a couple percent of our society that actually fall into that category. Yeah. So you're not alone, and we are all in this together, and we have each other, and we have a network of people that you can reach out to, whether it is a friend or a family member or a neighbor, or if you decide that you want to seek counseling. What's important is to not suffer alone, and to not only focus on those things like money or your job, or the varying things that got us through the day before all of this, but to also realize that other things have meaning and other things are important.
I tell you something that my wife and I have started doing, which I've been averse to for the longest time, and that is we've done several, Zoom calls with some friends of ours. I'm an audio guy because, to comb my hair and get, suitable for public viewing is like, I don't want to do that. And I do not look forward to the day that video calls are the standard, but it is what it is. But it takes it to a different dimension, we found, where if you're just sitting there and, having a conversation, cup of coffee, and you're looking at someone, it added another layer of connectedness. And it was interesting because at first it was like, I don't really want to Skype or whatever with let's just call them. But it was kind of cool cool. And it was, to me, interesting to see how that shaped it changed the dynamic for the better of the interaction with whomever it is that you're speaking with. To be able to see them is quite cool.
I absolutely agree with that, and I'm glad that you brought that up, because I also think that there are that most all of us have cell phones of some sort now, and have the ability to do a FaceTime or that sort of thing. To think about the population that are the most shut in, or that maybe are retired and don't work, or maybe have health problems that are at home in general. I mean, we're all in home now by self-quarantine, but people that really are lonely, that may live alone, whether it's a grandmother, a grandfather, an uncle, or an aunt, I think it's a lovely idea to think about maybe reaching out to them via FaceTime and checking on them and seeing if they're okay. And I promise, if you do that, you will probably get more out of the call yourself than they will ever get out of it, because that's a population of our world that brings so much and gives so much and have such life experience that they can share with us, that we can learn from and we can grow from.
And I saw one person, actually, well, there's a couple that survived the Spanish flu pandemic as well, in 1919, and then they beat the coronavirus. There was a woman in Italy.
Wow.
So yeah, there's a lot of wealth of comfort and knowledge there, in addition to being able to keep an eye on someone. You can see, when you're looking at people over the phone, a lot of times people, I'm doing okay, but they're not looking okay. So to add that additional dimension, I think, is a good thing. Well, I said we would talk for 15 minutes, and I'm already 6 minutes over. So let me but
we tried.
That's all right. I do have a couple of parting questions for you. One thing, if you had to summarize any advice or information that people should keep in the forefront of their mind as we're navigating through the next few weeks and months, or who knows how long ahead, what would that be? What would you pass on?
Well, it would be that this is definitely going to end. This is not going to be forever. That I strongly believe that as the weeks go on, we're 2.5 weeks in now, for the most part, of the people that are actually choosing to self-quarantine, and more, it's not a choice. We're having to quarantine.
Sure.
And so we're already several weeks in, that there is an end to it, that it is in sight, and that self-care during this time is way more important than it's ever been. Because in the past, we could get busy with other things. We could get our minds on other things. We could be involved in what I call the rat race, which is to get out there, work as fast as you can, play as fast as you can, meet people as fast as you can, almost that just kind of constantly going in different directions. We can't do that right now. We are self-quarantined, and now is the time that our brain is going to click in and start us worrying or having anxiety or thinking, oh no, what are we going to do? And the best thing that you can do during that time is to do self-care. And by self-care, I mean eating right. I mean getting the right amount of rest. I mean spending quality time with friends and family. I also mean even just a little bit of exercise. And when I say exercise, I don't mean you have to go out and run. I mean that physical exercise is I wouldn't make you do that. Physical exercise is as much as going for a little walk or a hike or taking your bike. It's getting outdoors. There's wonderful vitamins in our sunshine that we can get. We get some vitamin D that way. And to look for what you can appreciate, whether it be quality time that you wouldn't be getting with your kids right now. Look, whether it's getting outside and digging in the dirt and planting some flowers that you wouldn't normally have had time to do, or doing a little spring cleaning, but really simplifying and looking at what is the positive I can take. There might be 80% bad, but if you can find 10 or 15 or 20% good that's happening in your life right now, focus on that. And the end is near. Look for that light at the end of the tunnel, because it will be there. And when in doubt, if you're feeling isolated, if you're feeling like, I don't know if I can do this, now is the time to absolutely reach out and get some counseling.
What is the website address for Therapy Center Valdosta?
Yes, it's www.therapycentervaldosta.com.
And I'll go ahead and put that in the notes here as well. If folks are feeling inclined to seek out some self-care, now is an excellent time to do that. So I thank you so much for participating. Hang on here after I wrap this up, and then I'll say goodbye. For those of you who are watching, I didn't see any comments come through. That might have been because I didn't flip a switch, but we look like we're broadcasting. So what I'm going to do too? No, we are broadcasting. I just didn't see any comments come in. So who knows? But because this is open, this is shared. Feel free to send it. This is a public post, so you send it around the world if you want. And then if you got any questions for Patty, just put them in the comments. And I'm guessing you can kind of troll through them periodically. And if people have questions or want more information on how to contact you, feel free to respond to that. All right. Well, thank everyone for watching and participating. We've got some other guests lined up later in the week. Keep an eye on my feed for an announcement of that. And in the meantime, stay home, be safe, and wash your hands. Thanks a bunch. See you next time.